Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
You know me, Nita. I am living it up. And what about you?
You know what? I'm living it up also. Because I learned that
You've
from
learned.
you.
You've learned, grasshopper.
It only took 12 years.
You're getting there.
But perhaps sometimes I'm a slow learner. But it does take a minute to develop better habits. And we want our listeners to be able to live it up. But our listeners are mostly in chronic musculoskeletal pain. That means basically orthopedic pain. It includes muscle pain, joint pain, tendon pain, ligament pain, back pain, neck pain, knee pain, hip pain, disc pain, arthritis pain. Perhaps you have carpal tunnel syndrome pain, stiff joints, dull aches, lots and lots more. I can't even name all of it, but any kind of pain that you're experiencing that you think might be musculoskeletal in nature, give us a call. You can speak directly to Dr. Darrow right here in the studio. 866-870-5752 is our number. And when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. And you might want to check out the website for more information at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. It's a huge learning experience here today. So stay with us. Call. The number again right here is 866-870-5752. We are here Saturdays at 10 a.m. and again at 1 p.m. And there's other exciting things going on in the office, so stay tuned and you will learn a lot, and you might, just might, get a bit of a solution about your chronic pain. What do you think?
I think I'm going to go to a question real quick here to get the ball rolling.
All righty.
If you don't mind, Nita.
Do it.
And I get emails from my website all day, every day from all over the world, which is a lot of fun. I spend a lot of my day doing emails when I'm not with patients, in between patients. I run to my computer and crank out a few more answers. So if you decide you want to write me, just go to my website, www.lastemcells.com, and I'd be very happy to write you back and get the ball rolling for you for your pain in orthopedics. That's musculoskeletal, meaning the joints, ligaments, tendons, and issues related to that. So the first one I have here just came in. This actually just came in on Thursday. It says rotator cuff. Let's see what the person has to say. Simple. I have a torn rotator cuff and want stem cells, I think. Well,
I like that.
Well, I think, therefore I am. Who said that, Nita? Do you remember?
Oh, gosh. It was a famous philosopher.
Yes.
It was Descartes.
His first name, yeah,
René Descartes, yeah.
Yeah. So, I'm quite a bit of a philosopher myself, and I thought about what he said because I was thinking, and I thought, I'm not here because I think. I'm just here because I am. I made it simpler. It's just I am. That was too complex for me. Those philosophers think too much. But anyway, the rotator cuff is a series of 4 tendons that originate from muscles, and the tendons attach to the humerus, which is the arm bone, the upper arm bone, and they move it. So things like the subscapularis moves the arm close toward the body, and the supraspinatus lifts the arm away from the body the first 15 degrees or so. That's the most common one that's torn. Most athletes end up with supraspinatus, either tendonitis or tears. I have one also, and I've treated it myself. I inject myself, as all you folks know who listen to me regularly. What else do we have? We have the infraspinatus and the teres minor there. And these are all tendons that fit around the arm bone to move it. The arm has a lot of range of motion, so it's very prone to injuries. And we heal it. I treat shoulders every day of the week, and we treat it typically with PRP, that's platelet-rich plasma, very simple process where we draw your blood from your arm, just like if you're getting a blood draw from your doctor to check your labs, and we spin it in a centrifuge, and then we can isolate the platelets from the red cells, and we throw away the red cells because they can hurt. They irritate a little bit too much, and we just use the platelets, and we inject them anywhere we want around the body. So shoulder is very, very common. I'd say it's probably number 2. Knees are first. We get, they always say the knees go first. We do more knees than anything. Maybe low backs and shoulders fit in there similarly, but we do tons of shoulders. And also, when people think they have a rotator cuff tear, maybe a labral tear that we'll look at and treat. And I can see those. I can see the tears with my ultrasound machine. And I use ultrasound to inject shoulders and hips and knees, sometimes other joints. Sometimes it's not necessary. But it's really cool to look inside the body with an ultrasound and figure out what's going on. I don't decide where to treat just based on an image or an ultrasound, because we have to do a very good examination. Way too many times people come in the office and they've had a failed surgery. That means they had a surgery or more than one, and they didn't get better, they got worse. And I always ask, did the surgeon touch your body to examine you? And they go, no. Why did they need to do that? They slapped an MRI up on the light box, and we looked at it, and he showed me where the tear or the problem was, and he operated on it. And that's not in my thinking. And look, I'm just a little guy. I'm one guy, with my experience. I'm not saying the way life should be in medicine, but I don't think it's proper to do a surgery without an examination. And the examination can tell us where the pain is being generated from. So I'm always looking for the pain generator. I'm not looking at an X-ray or an MRI to decide where I'm going to treat. I like to have those to make sure there's no cancer or something strange going on. But we don't want to operate or inject into an area where there could be something lurking that can fire back at us. So I do like to get the imaging done, but I like to treat based on my examination. And this person who wrote this question about a torn rotator cuff, that may not even be what their problem is. They may have a bursitis. There's a big bursa underneath the acromion, which is the top of the shoulder, called the subdeltoid bursa. And that is where most shoulder pain comes from. When your orthopedic surgeon gives you a shot of cortisone into the shoulder, that's typically where he's injecting. He thinks it's going into the joint, but when you look with an ultrasound, most orthopedic surgeons don't use ultrasounds. They just inject blindly. And the studies show when you inject blindly into the shoulder or the knee, you're missing the joint about a third of the time. But if they can get into that bursa, they usually will heal up in the sense of getting rid of pain, that shoulder right away. I don't like to use steroids, of which cortisone is one, because they're Band-Aid. They can get rid of the pain very quickly. There's lidocaine in there. It numbs it right up. When we inject a shoulder with that mixture, the patient in 2 minutes goes, wow, it's healed. But then it comes back later. And in the meantime, while they're enjoying that numbing process of the lidocaine and the steroid, they're beating themselves up worse. And that happened to me. when I was in medical school, I had a shoulder injury, and I went to my orthopedic surgeon who I worked with doing surgery, and he injected me with a steroid. He did it once, and I thought I was all healed immediately, and I went out and did sports even more, and then it got worse. I came back, he did it again. And then I realized that that wasn't really doing the job, and it got worse again. So it took me a couple of years. Oh, actually, that's when I had surgery on my shoulder. He did surgery on it and made it really bad. My arm was full of fluid, and I had a fever. And at that point, I knew that becoming an orthopedic surgeon was not going to be the thing I wanted to do. So I learned about regenerative medicine and became, I'd say, an intuitive about it, because we didn't really have classes very much about it back then. And I learned how to do it by experimentation, you might say, on myself. And I've injected both my knees, both my elbows, my right wrist, both my shoulders. I've had other people do my neck and back. And I've had amazing success with it. And that's why I do these procedures, because they've worked on me. And over the last 22 years or so that I've been doing it, most of my patients get better. Some don't. Some people don't do enough treatments, and some people go out and beat themselves up in between treatments, and they don't give it a chance to heal. But most people it works on if we choose the patient wisely. And I want to give out my phone number to the studio right now so you can call me. I'd love to talk to you. The number to the studio is 866-870-5752. I'm going to repeat that. It's 866-870-5752. And if you want to get a hold of me at the office or get more information that we don't talk about on the radio, the number to my office is 800-300-9300. I'll repeat that for you again. That's 800-300-9300. I see the phones are starting to light up now since I gave the number out, so I'm going to give it out one more time. To the studio, you can talk live right now at 866-870-5752. If you're shy, you can just pretend you're somebody else, and or you can ask things about your family or your friends. But I'd like to help you. Before we get the calls racked up here, if it's okay with you, Nita, I'd like to go to another question, or do you have something you want to talk about?
Yeah, I just want to mention that the hour goes quickly, and I'd really love for you to call sooner than later, because at the end, sometimes we have so many people that it becomes difficult, and we may run out of time. So if you call us right here in the studio at 866-870-5752, we have lines open for you right now.
Love to hear from you. All right, so the next question I have, let's see. This one's about, the last one was a rotator cuff in the shoulder. This one is a meniscus question. Let's see which meniscus they're talking about. Usually people talk about the knee meniscus, but I had a rip in my meniscus in my wrist also that I healed by self-injecting it. So let's see what they say. I have a meniscus tear that has crystals on it. Okay, so what does that even mean? The meniscus they're talking about, I assume, is their knee, because that's most commonly when people talk about meniscal tears, what they're talking about. So I had meniscal tears in my right knee, and I saw it on my ultrasound. I injected it a few times, and it's not there anymore. So I used platelets and stem cells, and the stem cell procedure that I do in most people is very simple to do. It's aspirating a little bit of bone marrow from the back of the pelvis on a place called the PSIS, the posterior superior iliac spine. I numb up the area with a little lidocaine, and then I put the needle into the bone, which takes about 3 or 4 seconds. Then I aspirate out the bone marrow, which takes another 10 seconds maybe. So it's a very quick procedure. And it's not the type of bone marrow aspiration when people have cancer that's very painful, where they're taking a giant amount of bone marrow. This is just a small amount that we take out. People tolerate it really, really well. And then if it's a knee, we have to spin it to get rid of the red cells. The rest of the body, we don't even need to spin it. We can just inject it directly. So the crystals, what does that mean, to have crystals? So there are different crystal arthropathies. That means crystal diseases that are metabolic that end up in the joint. Gout is one of them, and that's fairly common. I see a lot of people with gout, and the place that gout hits most frequently is the big toe, the place where people get bunions. And if you've ever had a gout attack, you will never forget it, because it's considered to be one of the most painful things on the planet. People, when they have it, they say they can't even put a sheet on top of it when they're sleeping. It's so crazy with pain. So there are different crystal arthropathies, and I've treated some of the worst of them with very, very good success. I don't want to do it when you're having a quote attack, because then it's so inflamed that what I do doesn't help it at that point. But when it quiets down, patients come back, and then we can inject it and help get rid of that. So the meniscal tears I'm not concerned about. The crystal arthropathies I'm not concerned about. I'm sorry when people have them, but that we can usually heal them up. So that's the good news.
Okay, well, why don't we go over to Harry in Los Angeles?
Harry, Dr. Marc Darrow, how are you today?
If I was really good, I wouldn't call. I've got a weird sense of humor. I'm sorry.
We like
that. We both also have that. How long has your knee bothered you for? I see on the call screener board that you've got a knee issue.
Okay, so my knee has bothered me for several months, and I used to do martial arts, but I quit. So I had a cortisone injection about 3-4 weeks ago. And then the doctor told me to take, I don't know the name of the cream, but it used to be a prescription. Now it's over the counter. I can't think of the name of it. And I put that on there a few times a day, which stops the pain. But it's still not feeling great. And I don't know if he took an x-ray and he said there's maybe a bone spur, but I don't know why he would give me cortisone if it's a bone spur. Maybe I'm wrong. But you were talking about.
I don't know, Harry. I don't know why he'd give you cortisone at all.
Well, I don't know. Maybe he thought it would get rid of it for the short term. But
do me a favor. I want you to Google the word cortisone, okay? Yeah. And tell me what the studies show.
Well,
Nita, do you know?
I can't do that right now.
Yeah. Well, okay. Here's the thing, Harry. We'll make it easy for you. Cortisone destroys bone. Is that true?
Well, actually, it's the cartilage on top of the bone that softens up. So the way I think of it is you get to win the battle because your pain is gone instantly, but then you lose the war because it's going to end up getting worse. So that's not something that I like to do with anybody. And I know the doctors say, well, you can do it 3 times a year. I don't think that's a great idea. If you want your knee to stop hurting, fix it. How do you fix it? You use regenerative medicine. What is that? You use platelets or stem cells. And that actually regrows.
Like a PRP.
Yeah, you do platelet-rich plasma, PRP, or stem cells, depending how bad it is.
No. Okay, so they did PRP in my elbow because I had an elbow from doing too many, I had tennis elbow from doing too many push-ups. So you would suggest doing PRP to my knee. And
I don't know what to suggest because I haven't examined you, but I wouldn't suggest cortisone.
Right. Where's your office?
I'm across the freeway from UCLA on Wilshire, right off the 405.
Oh, okay. I wouldn't
tell me that's too far.
No, it's not. I live right across the street from Cedars-Sinai, so it's really not a big deal.
Well, I think it's funny. I laugh all the time because sometimes people, when they call the show, they go, well, I live in Arcadia, I live in Whittier, I live in Long Beach, I live in Mission View, whatever. And they go, and that's too far to go.
Why is it too far to get rid of it? Why would it be too far?
Well, exactly. I mean, my average patient drives about 2 hours to get to me overall. But I crack up when they say that, because we have people that fly in from all over the world to get treated. And then some people, it's too far to drive for an hour or two to get healed. That doesn't make sense to me.
No, I agree. I drive an hour to work and back every day, so driving is no big deal.
So do I. Yeah, I drive. Same with me.
Yeah. So, okay. So, your office, your office number. I wouldn't mind making an appointment to come see you. If you give me your office.
The office number, well, I'll give it to you right now, is 800-300-9300. I'll repeat it while you're writing. 800-300-9300.
Okay,
and I'm right off the 405 freeway at Wilshire Boulevard. It's very easy to get to.
Yeah, you're 20 minutes from the house.
Perfect.
So it's no big deal. Yeah, I mean, how close are Cedar Sinai? It's that close to you, so it's not a big deal.
Yeah, very
close.
All right.
I appreciate your time, because I really want to go back to working out, but I'm afraid to, because I don't want to make it worse.
I'm not worried about your knee. Harry, listen to this. I'm not worried about your knee. Okay? There's nothing terrible going on, and you're not going to blow it out, so I wouldn't worry about it. When it's time,
Well,
that
you
you're
know, my
sick
work,
of the,
I take a
pain.
martial arts class.
Well, that's fine.
Once
we treat you, you're going to have to slow down so you can allow it to heal. But right now, I don't really care what you do.
So how long does it take after the PRP that I could go back to working out?
That depends. I don't have an answer. I don't even know who you are. I've got to examine you, decide what the treatment will be, and then we have a conversation. You know, the way I tell patients, Harry, is most patients cheat on me. You know what that means? Yeah, they don't listen to my advice.
They're really doing.
Yeah. I mean, there's one guy that I laughed at. I did a stem cell injection on both of his knees with platelets. I think it was bone marrow back, this might have been 3 years ago or so. And he came back 2 weeks later, and he was real grumpy, and he said, "It didn't work." And his wife was sitting there, and I said, "Well, did you exercise it?" Because I knew he was a big-time golfer. And he says, "No." And then she was rolling her eyes, laughing, and she said, "Honey, you played golf 3 times in the last 2 weeks." And he goes, "Okay, so what?" So that's cheating on me.
No, I understand. I have a question.
The wear and tear in his knees was from playing golf many times a week. He was a wealthy guy, and he didn't have to work much, so he played golf. So I said, "Well, you know, it's your choice. You can come back and get treated a lot, or you can let it heal and then not have to see me anymore. Your choice. It's always the patient's choice."
Yeah, I understand. Now, I was under the impression that stem cell replacement is not legal in the United States.
Okay, well, your impression is wrong, but that's fine.
No, thanks for letting me be okay by being wrong.
No, I didn't say you're wrong. I said your impression is wrong.
It's okay.
It's a lot different.
Yeah, it's okay.
Yeah, the way I tell people is they come in every day and they go, "I read this, I read that," and I tell them most of the stuff you read on the internet is by people or doctors that don't do very much of this. Okay?
I'm going to give you something that I believe sincerely. I don't believe in healing myself through the internet, because it's a bunch of garbage. Nobody, it's just terrible. If you diagnose yourself on the internet, you're an idiot. I mean, that's my personal opinion. Because I don't believe you can do that. I mean, I have all the confidence in you. You went to school, you did all that. That's what you're supposed to be doing.
Yeah, but I only was in college for 22 years.
Well, that's not long enough, but that's okay.
I was just going to say that. I like you, Harry.
Well, you know, without a sense of humor, what do you got?
You got nothing without that. Anyway, Harry, we got people waiting. So God bless you. I hope we get to see you.
Okay.
You can actually call in right now to the office, because people are by the phones. It's 800-300-9300. 9300. 800-300-9300. God bless you, man.
All
You're
right.
a good man.
All
Thank you,
right.
Harry.
So Chris and
Okay.
Bob, please stick with us. We
Yeah.
have a short break,
We do.
and then we're going to come back and take your calls.
We will. And you're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back after this.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.